To achieve a gender-equal world, we must reduce the many barriers that prevent women and girls from fully participating as equals in their homes, economies, and societies. This includes eliminating the barriers that prevent them from accessing family planning information and services. A brighter, more equitable future is in store for all when women and girls have control over their bodies. Advancing gender equality and improving access to family planning are two goals that powerfully and mutually reinforce each other. We spoke with Dr. Anita Zaidi about her work overseeing efforts to achieve gender equality at the Bill and Melinda Gates Foundation.
The reality is, no matter where you're born, your life is harder if you're born a girl. When a woman can plan and space her pregnancies, a woman and her baby are more likely to survive and be healthy and much less likely to be malnourished and stunted. Family planning also allows girls to finish their education, have better job opportunities, and get paid for their work, building a brighter future for themselves, for their families, and for their communities. It's increasingly clear that achieving our goals or gender equality are closely linked to our success in other areas, whether that's ensuring more women have control over their own bodies or can access quality maternal health services.
Addressing the barriers women and girls may face when accessing family planning services is a major step towards a more equitable world.
Gender roles and norms often constrain women's and girls' agency, preventing them from making decisions, seeking or accessing contraception and family planning services. In some places, healthcare workers may ask a woman for her marital status and deny her contraception if she is unmarried or still an adolescent. Even a married woman might need her husband's permission or her in-laws' permission before she can use contraception. Women are often the ones who manage their family's health, and yet our health systems aren't designed with them in mind. Women have to make one trip to the clinic for immunization, another for family planning, a third for pregnancy-related care, and so on. For too long, gender has largely been ignored or siloed in global health and development efforts. And as soon as we take a gendered lens on the delivery of care, whether it's family planning or immunizations or antenatal care, we see that the most important action we can take is to learn from women about the best ways to meet their own needs.
The Gates Foundation is supporting programs like the Challenge Initiative that coach local governments in using a gender lens when designing their family planning programs. TCI's interventions address gender barriers such as partner opposition by engaging men and promoting better communication between couples. And its advocacy interventions ensure women and girls are engaged in policy-making efforts that affect their health and well-being.
We are proud to work with partners like TCI that understand that women and girls must have a seat at the table when designing programs that are intended to overcome the barriers that women face and to be able to meet their needs. When women are in more equitable relationships, they can discuss and make family planning decisions with their partners, and they're much more likely to use contraception to prevent or space their pregnancies. When women and girls are healthy, empowered, and able to fully participate in society, it ignites a virtuous cycle that impacts other health and development outcomes, as well as the country's economy. Empowered women can transform societies. And to fully participate in society, women and girls must have agency over their bodies, their health, and their futures.